Well, I think the thing you got to realize is that the patients that we see down here, we know these patients. We live with these patients. We go to church with these patients. We see them in the grocery store. And it's a lot different, I think, doing the colonoscopy on a patient that you've had a long-term relationship with, that you know personally, as opposed to just knowing them when you see them in the office, or maybe just seeing them one or two times and then not seeing them again for 10 years. We see our patients on a regular basis, and our patients know us. So I think that's part of the team approach, starting with the doctor-patient relationship. And the other part of the team approach is that we have set nurses that we work with every time we come down, and we have the same expert that helps us deal with difficult cases. So it's not like there's a lot of turnover, or that there is a lot of people coming and going through the center. We have a fairly stable group of folks that help us with our procedures, and I think that means a lot. We do it a little bit differently in that the physician will manipulate the knobs to turn the tip of the scope up or down or right or left. And then we have the nurse or technician that will advance the scope and push it very slowly. And I think it makes it easier to do the procedure that way. I think that every person that's ever done the procedure, gastroenterologist or family practitioner, has had someone help them advance the scope at some point in time.
But you got to do that as a practice.
We do it as a routine basis, and I think it makes it. You also have another set of eyes looking for polyps, and I think that's an important part too, is that with the two nurses in the room as opposed to just one and maybe at other facilities that may be doing multiple things, we have an extra set of eyes that are looking for polyps, and I think that helps us find more polyps and have an increased polyp rate than you may have at other places.